All right. Hello, everyone. It's my pleasure to introduce Eliza Markwell. Eliza is a senior and a member of the Augustine House. She has integrated psychology and history into her capstone on mental health entitled The Manipulation of Medication, A Journey Through the Evolution of Torture in Mental Asylums to the Present Psychiatric Care. Let's welcome Eliza.
Thank you, Ms. Brown. Many of today's mentally ill live on society's margins, either sleeping on the streets or drifting among prisons, jails, welfare hotels, and outpatient facilities. As their diseases go untreated, they do significant harm to themselves and their families. Our failure to care for them recalls the inhumane era that preceded the rise of the state institutions. The time has come for new facilities and a new moral treatment. James Pinero, in City Journal, writes how he thinks our world today is lacking in caring for the mentally ill, and that psychiatrists are causing the sick to feel neglected. James Pinero's quote shows a connection to the way many people feel about medication. Numerous individuals feel as if medication is a benefit to society to cover up people's abnormalities, rather than a benefit to fully heal the patient, giving another reason for the sick to feel neglected. Mental health treatment through the ages has evolved from the torturous methods found in asylums to today's psychiatrists' offices, where medication becomes the primary solution to our mental health crisis. However, not all psychiatrists rely wholly on medication, but have experimented with alternative treatments such as psychotherapy and holistic therapy, which are proven to result in more permanent changes in an individual's brain. By using these treatments, they will increase the chances of achieving remission of an illness, shorten the time required to achieve remission, and enhance the treatment. The concept of mental health illnesses has been around since the beginning of time, but it was not until the 18th century that people decided something had to be done about the mentally insane. Over time, several mental institutions were established, primarily intended to house the mentally ill rather than treat them. Before asylums, care fell to families, or if lacking that, people often became homeless, and access to asylums was largely limited to wealthier families who could afford the cost. This raised questions about the true purpose of asylums. Many people quickly filled up these asylums, but they soon realized that they were not going to get the help that they needed. As history progressed, society would use these asylums as places to lock away those who were not like them, including people with what we would now consider to be low-level learning difficulties. At this time, mental health treatment was not developing well, so mental health conditions we recognize and treat today may have been considered signs of madness back then. The most common mental illnesses found in patients living in asylums during the 18th century were melancholia, mania, and dementia. The public feared those with illnesses, figuring that they had lost their minds completely, and there was no way for them to be healed. So as a result, they were put into an asylum to be locked away and removed from the world. These mental illnesses were just some of the disorders affecting citizens in the 18th and 19th centuries. Psychiatrists at the time lacked an understanding of mental health and saw it as medical conditions related to demonic possession or complete madness, and they thought the only way to relieve these people from the illness was torture and beating it out of them. Despite the fact that people were sent to asylums to be watched over, asylums were actually known for their harsh treatment and violent control of their patients. Psychiatrists focused on control and keeping the sick contained, rather than healing and finding cures. Some of the most common therapies used in asylums at the time consisted of electroshock treatment, chaining patients to walls, using restraints, isolation, and more. Instead of improving their condition, patients were more miserable than they had been before they came in, or in extreme circumstances, they would die from the torture. In 1829, a man named William Scrivener was strapped to his bed overnight in a straitjacket, and in the morning, he was found dead, having been strangled to death by his restraints. Some people considered asylums to be brutal and demoralizing, as well as dehumanizing, and the restraints only led to more violence instead of reducing it. Rev H. Chase, in his book, 2 Years and 4 Months in a Lunatic Asylum, gives proof of the horrible restraints. Quote, "Here men are bound in fetters and laid in irons. Many of them are so crazy that they are obliged to be kept bound, some in cribs, some handcuffed, some tied down in seats, some with muffs, and many of them in straitjackets." End quote. On first entering a mental asylum, Chase was horrified by the torment patients were facing. These practices did not treat the patients per se, but they did discipline them, as well as psychiatrists, slowly setting the stage for psychiatry's transformation into a system of medication-based control. The community began to view treatment in mental asylums as moral failures, and because of that, a few people recognized that something had to be done about it. One of the first attempts to help the insane who were involved in asylums was the Lunacy Act of 1774, which required that 2 doctors per patient had to have medical certificates for the patient to be admitted into the asylum. Asylums had to be registered and annually inspected, and all the inmates had to be registered by a central authority. This act was a huge step in changing the treatment of mental health, but it still did not prevent inhumane experiments. Soon after the Lunacy Act, new reformers for mental health were seen. Some of the most popular were William Tuke, Harry Martineau, and John Connolly. William Tuke lived from 1732 to 1822, and he founded the Retreat, a mental hospital. His asylum was distinct from others because he implemented a non-restraint policy and began to develop the concept of moral treatment. William's grandson, Samuel Tuke, wrote a book called Description of the Retreat. In his book, he explains how the treatments at the retreat were more effective and humane than those at other mental institutions. Later in his story, he explains a physician's perspective on treating people and how his views are more in line with those of humanity. In Description of the Retreat, Samuel Tuke states, quote, "The physician plainly perceived how much was to be done by moral and how little by any known medical means. He therefore directed that any medicine which he might prescribe should not be administered where the aversion of the patient was great, unless the general health strongly indicated its necessity." End quote. The respect this physician has for morality, as exemplified by Samuel and William Tuke, led to the first major era of treatment. The first major social reform movement, the moral treatment era, in the early 19th century, started by addressing the care of individuals suffering from mental disorders and figuring out a moral way to deal with them by getting rid of the harsh treatments. During this period, more mental institutions were constructed, but similar to the Retreat, they valued the ideals of morality and sought to treat their patients with the utmost compassion. These mental institutions filled up very quickly since people wanted the absolute best care. But because they filled up so quickly, this led to overpopulation in the institutions. However, as the population increased, the quality of the moral treatment care decreased, and eventually these overcrowded hospitals abandoned the goal of treatment in favor of containment. The second major reform was the mental hygiene movement, which began in the early 20th century. A psychiatrist named Adolf Meyer brought to life the idea of mental hygiene, which tied mental illness to psychiatry with neurology, biology, and physiology, and he thought that asylums could develop into psychopathic hospitals, which would be used to research the patients to try and find cures for them. These hospitals were constructed around the United States, but they were not able to change the state of mental health. Again, over time, the original goal of researching the patients and providing patients help slowly evaporated. These hospitals started to receive patients without mental health disorders, but other sicknesses, such as syphilis, which proved to be unhelpful to the psychiatrists wanting to research mental health. After World War II, people wanted to reshape the mental health system once again, which started the last two movements, the community mental health movement and deinstitutionalization. With the help of the National Institute of Mental Health, psychiatrists explained that mental health was now a public health concern, and they wanted to figure out better treatments that could relieve individuals of their illness. Soon, antipsychotics were created and approved, and that quickly drew out the rest of the invasive techniques found in the institutions. With the introduction of medication, people began to liberate the patients from the asylums and relieve them from their hospitalization, which led to deinstitutionalization, a protest to eradicate all mental asylums. But many people started to wonder if medication would really be better than going to a caring hospital with psychiatrists who would give them compassionate treatment. Medications made their first appearance as a way to relieve poor mental health in the 1900s, and they caused people to feel like medicine would be a real cure for the ill. The first major antipsychotics created in the mid-20th century include chlorpromazine, CPC, otherwise known as Thorazine, imipramine, isoniazid, and meprobamate. CPZ started the future of medication. In the May 1954 issue of the American Journal of Psychiatry, SKF announced, quote, Thorazine is useful in controlling anxiety, tension, agitation, confusion, delirium, or hostility, whether occurring in schizophrenic, manic depressive, toxic, or functional states, end quote. The success of Thorazine led to the first antidepressants, imipramine and isoniazid, and to one of the first anti-anxiety medications, meprobamate. These medications marked a major turning point in history, moving away from mental institutions to a more chemically controlled approach. Because many people were hopeful for a cure, many accepted antipsychotics without fully understanding their risks or effects, believing the medications would wholly heal them. For example, taking Thorazine can be risky regarding the extrapyramidal side effects, which might negatively impact an individual's life. Still, for those suffering from schizophrenia and bipolar disorder, this medication can help them live a closer to normal life, without worrying about harming someone or something. Countless individuals who do realize the risk of taking Thorazine take it anyway because of their desperation to be relieved from their mental disorders, no matter the side effects. So, when did people start thinking that psychiatrists were overprescribing medication when clearly they appear to be looking out for people's best interests in the 20th century? Medication has become an even more major societal concern in the past few decades, and being able to understand the details of the mental disorders can help reduce the rise of sick individuals. According to the World Health Organization, nearly 1 in 7 people in the world live with a mental disorder. Because mental health disorders are becoming increasingly common, many people question whether psychiatrists are overprescribing medication to manage symptoms quickly or to really heal the patients entirely. This has led to growing concerns about whether psychiatric medication is a lifelong necessity or a true cure for mental illness. Some of the most common mental illnesses as of 2020 are anxiety disorders, depression, bipolar disorder, ADHD, and OCD. These are the most common types of mental illness today, and each of these illnesses has a separate medication used, serving similar purposes to those of the first medications in the past, but are much more commonly prescribed. Medication is so widely prescribed, but people are complaining that they are not being healed from the medication. This has caused widespread concern as the rapid increase in mental health issues and need for change. In Kendra Campbell's article, Are We Drug Dealers or Soul Healers?, she takes a side against medication, saying that psychiatry is becoming drug dealing rather than healing. Quote, the result is that psychiatrists have become reduced to illegal drug dealing and have unwittingly become puppets for the pharmaceutical industry. Patients come to us looking for healing, but they receive a prescription for a pill that will do little more than mask the symptoms of a larger underlying issue, and many times it won't even do that. The only support the patient typically receives from their psychiatrists is via 15-minute med checks that happen once every few months. The whole process becomes more about managing medications than the actual well-being of the patient, end quote. Campbell's take on medication claims that patients come to psychiatrists wanting to be healed, but instead they are handed a drug that will only cast a shadow on their symptoms. Campbell is not alone in her opinion. Dr. Orna Ofer on Psychology Today states that psychiatrists are working too hard to make society normal by trying to eliminate these diseases with only medication, and by doing this, it gives them some kind of control over their patients. Earlier claims about the ineffectiveness of taking medication can be seen in Susanna Kayson's autobiography, Girl Interrupted. Quote, the only power they had was the power to dope us up. Thorazine, Valium, the therapist's friends. You're doing so well, the resident would say. That was because those things knocked the heart out of us. End quote. Susanna Kayson, a woman sent to a mental hospital in the 60s, proves that medication has never been truly perfect, by explaining her own experience. Overall, these different forms of evidence demonstrate the overprescribing and the insufficiency of medication for mental disorders. But if medication is not the best solution to reduce the illnesses, what is a good solution? One of the solutions to reduce disorders other than medication is talk therapy. Talk therapy, also known as psychotherapy, is a form of treatment in which an individual discusses their emotions, thoughts, and feelings with a trained therapist or psychologist. Des Spence in the British Journal of General Practice talks about an article he read claiming that ADHD should be given more prescriptions to medication because it is undertreated. And Spence explains how he disagrees with this because it is common for children to have issues with hyperactivity and inattention. But instead of adults labeling this as normality and supporting the children, they label the children for life, prescribing psychoactive medication as their only means to help. This opinion on this matches what people call normal behavior illnesses, which consist of disorders such as depression, ADHD, and anxiety disorders. Some psychiatrists and psychologists think that these illnesses specifically are being incredibly overprescribed, and if psychiatrists just took the time to try and talk to these patients, they could be healed, which leads directly to the idea of talk therapy. ADHD, depression, and anxiety disorders are all a part of cognitive behavioral therapy, meaning that these three illnesses have a higher chance of being treated with talk therapy and without medication, because it provides strategies to manage emotions. According to Ritu Chatterjee on NPR, between 2018 and 2021, it was discovered that adults receiving mental health care, those using medication, declined from 68% to 62.1%. And at the same time, the percentage of patients who received talk therapy grew. Some psychiatrists even suggest combination treatment, which is the combined use of psychotherapy and medication. This is commonly used for bipolar disorder, schizophrenia, and severe depression disorders. And there is one other alternative to treatment, which Kendra Campbell suggested, taking a holistic approach. Campbell states, quote, "Instead of prescription pads, holistic psychiatrists use intuition and love to connect with people who are suffering and understand them as beautiful beings. Instead of using toxic pills to treat so-called mental disorders, we empower our patients to look deep within themselves to understand the root cause of suffering," end quote. This process of holistic approach leads to treating the entire person, focusing on the emotional, physical, mental, and social aspects of a person, causing lasting changes in an individual's mental health. A holistic approach can influence a person's physical life by impacting their daily life with methods of therapies, nutrition, mindfulness, and exercise. In the end, medication can help a human being with their mental illness, but using psychotherapy or taking a holistic approach can provide more effective changes in someone by working not only mentally in the brain, but also physically. This study proves that mental health treatment through the ages has progressed from the inhumane care found in mental institutions to today's psychiatrist offices, where medication becomes a core strategy to our mental health crisis. However, psychiatrists have proven, with results of alternative treatments such as psychotherapy and holistic therapy, lasting changes in the human brain. It was shown that after medication was created in the 1950s, it quickly became the #1 resort for psychiatrists to turn to, eventually deinstitutionalizing mental asylums. Although medication quickly became popular, it did not eliminate the mental health crisis and may have contributed to its growth. While some psychiatrists rely heavily on prescribing medication rather than engaging deeply with the patients, others recognize its limits and turn to psychotherapy and talk therapy. This matters because mental illness is serious, and without meaningful personal treatment alongside medication, the mental health crisis will only continue to worsen. Our world deserves to be free from the hold of mental disorders, and if medication truly is not going to help eradicate these illnesses, then alternative therapeutic approaches, like those of psychotherapy and holistic therapy, need to overtake the basic treatment of medication. Thank you.
Great job, Eliza.
Wonderful job, Eliza. It was wonderful talking with you and researching. You clearly are very passionate about your topic and came up with a wonderful argument. So I have one question for you, and then I'll extend the questions to the faculty first and then to the students. So within the time period that you researched, what did you find the most influential movement to be on mental health?
Out of the 4 movements that I've researched, I definitely think all of them had very big impacts on the mental health treatment. But personally, I feel like the last 2, the community mental health movement and deinstitutionalization, were probably the most influential on what our world is experiencing today, because medication was created in the community mental health movement, and I mean everything is medication when like I talked about. So that because of the creation of medication, I feel like that really influenced our world today. And then in deinstitutionalization, we got rid of all of the harsh treatments left over in asylums. And there are still mental hospitals around today, but they are not nowhere near what mental asylums were today. So yeah, those are what I think the most influential are.
So then I'll extend questions to the faculty.
Dr. Ebert.
Thanks, Eliza. That was excellent.
Thank you.
My question is about, obviously there's a lot of talk about mental health among younger people today. I'm curious, as you kind of chronicled the history from treatment of mental health in the early days, from like medicine to holistic, I guess I'm wondering, is there something new with the kind of rise of mental health struggles among especially the young that calls for even kind of further reflection on what's the cause of this, how is it treated? I guess I'm wondering if you thought of that in kind of as you looked at the history.
What do you mean by something new?
I don't know. It seems like it seems like it is somewhat unusual that there's so much documented mental unhealth among younger people, especially I'm thinking of like Jonathan Haidt's chronicle, especially like teenagers. This seems to be like unusual in history. It's not that teenagers have always been stable. None of that. But there seems to be something like unsettling in the last 20 years or so.
Yeah.
So I guess I'm curious where you think sort of that fits in your story of kind of the treatment of mental health.
Yeah, that is unusual. I know that a lot of teenagers have been affected by mental health, and not only teenagers, adults as well. I did not research a ton of like what is causing the mental health now, but I did talk about with my parents last night actually. They asked a similar question, and yes, it is very unusual that teenagers are expecting so much on health, but I don't know exactly all of the reasons that could be. It could be family problems, friend problems, but I do feel like a lot of it, the social media aspect and how that is definitely playing a big role on the mental health that teenagers have. So I think.
That's great, thank you.
Yeah.
And if anyone else has questions, go ahead.
Anna?
So I talked to my mom about your capstone, and she mentioned to me that my great grandma got committed into an asylum, and my mom was like, "Oh, the reason is because she was suffering from really bad postpartum depression." So I was wondering how you think, or like how the treatment of women has changed, especially from people being committed for issues like postpartum depression that aren't exactly mental disorders. I was wondering like what % of people that would be, and then how the treatment would
What
have
percent
changed.
of?
Or like how many women you think are unfairly committed for issues like that?
Yeah, I definitely in the past, during the mental asylum era, there were a lot of women that were admitted for not a very good reasons. A lot of women back then had what they called hysteria, and there wasn't like a specific like reason why, but they said that hysteria affects mainly women, and that was basically like women just like would get really mad or crazy at home, and so a lot of women were diagnosed with hysteria back then or depression, even though their symptoms might have not actually been that like bad that they had to go to an asylum. I didn't do a lot of research on the like women, but I didn't know that many women were known to be more hysterical, and some people think it is because of the hormones in women, and just like I researched this. I saw one website that talked about how they think that back then when women were on their periods they might act differently, and that was something that a lot of people didn't actually know a lot about back then, and so they thought it was hysteria. And so now we have like evolved from that, and so I think, I mean, equally men and women do have their own sorts of depression and their own mental illnesses, but I think women are treated a lot more fairly now than they were back then, and they also have like they've looked at like hysteria is not a very known, it's not like an actual illness anymore, It could be known as just like mania or something else, but women are definitely treated much better now than they were back then. Augie?
In your opinion, what would be the worst mental illness to have back then?
So I did say that the three main were mania,
But like in your opinion.
I know, I'm getting I did say the three main ones are mania, melancholia, and dementia, but there's also schizophrenia, and I think schizophrenia, which it's still around, I mean, all these are still around today, but, oh, wait, sorry, I just remembered, so dementia actually, dementia back then was not what you think it is now, with mainly older people are losing those facets in their brain. It's not like, it was not like that back then. Dementia was actually schizophrenia. And so I think that was very, very common back then. I definitely think that would have been horrible to have, because I don't know if everyone here knows what that is, but it's just a lot of seeing things, and that can cause you, and having bad thoughts in your brain that can cause you to harm others or harm yourself. And it just seems very scary, and I definitely think that would have been hard to deal with, because there really was no way back then for people to be safe from that. So yeah, I think that was bad.
Thank you.
Yeah, Susanna.
So you were talking about the history of the mental asylums. Where specifically were you like talking about? Like, were you talking like only the U.S., or was it like a specific like countries you were looking at that like were specific in like sending a bunch of people to mental asylums?
I wasn't looking specifically anywhere like specific, but most of my research, like when I was looking at websites, it was just talking about the asylums in the U.S. They'd say like, oh, the United States asylums were like this. So I didn't like on purpose like be like, oh, I'm just gonna look at the U.S.
Mm-hmm.
But that was just pretty much where most of my research was. I did do a little bit of research on a few other asylums that I know were not in the U.S. Like I think it's in London. That it's a St. Mary Bethlehem. It was like the first asylum. It's now known as like Bedlam, or it's not for anymore, but it was known as Bedlam, and that was created in 1247, which was like really early by my research. But I mean, there it was still similar to what you would find in the U.S. So it was pretty much just all around, because they were all giving like the same treatments.
Mm-hmm.
Cecilia.
Was there a lot of like overdosing because of did they know like how much medication to give?
In the beginning?
Yeah, at the beginning when they were making the medication.
So yeah, actually I talked about in my original paper, I had to cut it down a lot, but in my original paper I researched a lot more about the start of medication, and so right when it came out, they started creating these many medications, and as time went on, people would take them, and then a lot of doctors and psychiatrists would realize that people are getting addicted to them, and they were causing like withdrawal symptoms if they were trying to take the medications away. And then so there were like bans placed on these medications, and so that's why a lot like Valium is like it's not illegal unless it's an illegal substance to have by yourself now. Like you can just give it around people, because it is dangerous and it can cause people to really overdose and it'd be dangerous to them. But back then, people who were taking it, they found out that like, oh, this is not good for them, and so they had placed it under the illegal substance law, I think. And so basically, just over time, they realized that if people were overdosing on this and becoming dangerous, then this is a dangerous medication to have, and we should reduce just handing it out freely. Yeah. Mom.
I would like to know, in your research, as you talked about some solutions, did you encounter faith as any kind of area of weaving that into finding healing
yeah,
through that?
I did not specifically research that,
Okay.
but I definitely think that I wish I had originally my capstone I wanted it to be like comparing and contrasting people who had mental health and who are living without faith, and then people who have mental health and who have faith, and if that like if they are, their symptoms are less or they don't have any symptoms because of faith. But I don't know like exactly because I did not end up researching that, but I definitely, in my opinion, I definitely do think faith has a huge part to play in it.
We have time for one more.
Right. Maybe.
Okay, I was wondering, you said like more therapy and talking through it was better for ADHD and Western.
Yeah.
If your patient was like very willing for therapy and like talking through it, more than medication and a really good therapist, do you think like all mental health could be not solved but like dealt with?
That's a great question. I do think that if patients were more willing to talk with therapists, then that could maybe potentially decrease the rise of mental health. But that also depends on the patient, and they have to be willing to put in work to get better instead of just taking medication because that's all I want to do.
Thank you so much. Let's give a round of applause.